What is the first drug administered during adult cardiac arrest with shockable rhythm? A. Atropine. B. Amiodarone. C. Epinephrine. D. Lidocaine. Answer, C. Epinephrine 1 mg 4/IO is administered every 3 to 5 minutes during cardiac arrest regardless of the rhythm. It is given after the second shock for shockable rhythms. Which rhythm is considered shockable in the ACLS algorithm? A. Pulseless electrical activity, PA. B. Asystole. C. Ventricular fibrillation, VF. D. Sinus bradycardia. Answer, C. Ventricular fibrillation and pulseless ventricular tachycardia are shockable rhythms. PEA and asystole are not. What is the recommended compression to ventilation ratio for a patient without an advanced airway? A. 30:2. B. 15:2. C. 10:1. D. 5:1. Answer, A. For adult patients in cardiac arrest, the correct compression to ventilation ratio is 30 compressions to 2 breaths without an advanced airway. What is the recommended depth of chest compressions for an adult? A. At least 1 inch. B. About 2 inches. C. At least 2 inches. D. More than 3 inches. Answer, C. High-quality chest compressions should be at least 2 inches, 5 centimeters deep for adults. Which of the following is an appropriate indication for synchronized cardioversion? A. Ventricular fibrillation. B. Pulseless VT. C. Supraventricular tachycardia with hypotension. D. Asystole. Answer, C. Synchronized cardioversion is used for unstable tachycardias with a pulse, such as SVT with hypotension. What is the proper dose of amiodarone in cardiac arrest after the third shock? A. 150 mg. B. 300 mg. C. 1 mg per kilogram. D. 0.5 mg. Answer, B. The initial dose of amiodarone during cardiac arrest is 300 mg 4/IO push after the third shock. When using a bag mask device without an advanced airway, how often should you deliver breaths during CPR? A. Every 5 to 6 seconds. B. Every 10 seconds. C. Every 2 seconds. D. Every 15 seconds. Answer, A. When not using an advanced airway, deliver 1 breath every 5 to 6 seconds, 10 to 12 breaths per minute. Which rhythm should you defibrillate immediately? A. Sinus tachycardia. B. Ventricular fibrillation. C. Atrial flutter. D. P. Answer, B. Ventricular fibrillation is a shockable rhythm that requires immediate defibrillation. What is the most important initial action when a patient is unresponsive and not breathing normally? A. Start 4-line. B. Give atropine. C. Activate emergency response and begin CPR. D. Attach monitor. Answer, C. Early recognition, activation of emergency response, and immediate CPR initiation are crucial. Which advanced airway allows for continuous chest compressions? A. Nasopharyngeal airway. B. Laryngeal mask airway. C. Bag valve mask. D. Oropharyngeal airway. Answer, B. An advanced airway such as a laryngeal mask airway, LMA, allows for continuous compressions with asynchronous ventilation. What is the target oxygen saturation in post-cardiac arrest care? A. 80%. B. 94% to 99%. C. 88% to 92%. D. 100%. Answer, B. The goal is to maintain oxygen saturation between 94% and 99% to prevent both hypoxia and hyperoxia. What is the first step in the ACLS bradycardia algorithm? A. Immediate pacing. B. Atropine administration. C. Assess for symptoms. D. Administer epinephrine. Answer, C. Always assess if the bradycardia is symptomatic, e.g., hypotension, altered mental status, before treatment. Which drug is first-line treatment for symptomatic bradycardia? A. Atropine. B. Epinephrine. C. Dopamine. D. Lidocaine. Answer, A. Atropine 1 mg for every 3 to 5 minutes is the first drug for symptomatic bradycardia, up to 3 mg total. What is the maximum dose of atropine for bradycardia? A. 1 mg. B. 2 mg. C. 3 mg. D. 4 mg. Answer, C. The total maximum dose of atropine is 3 mg. What is a common reversible cause of PA? A. Hypercalcemia. B. Hypervolemia. C. SVT. D. Tension pneumothorax. Answer, D. Tension pneumothorax is one of the H's and T's reversible causes of cardiac arrest. In adult CPR, what is the recommended rate of chest compressions per minute? A. 80 to 100. B. 100 to 120. C. 120 to 150. D. 60 to 80. Answer, B. The recommended rate is 100 to 120 compressions per minute. What is the correct dose of epinephrine in a pulseless arrest? A. 0.5 mg. B. 1 mg every 3 to 5 minutes. C. 3 mg immediately. D. 5 mg bolus. Answer, B. Epinephrine 1 mg 4/IO should be administered every 3 to 5 minutes during CPR. Which rhythm is not shockable? A. Ventricular tachycardia with pulse. B. Ventricular fibrillation. C. Asystole. D. Torsades de pointes. Answer, C. Asystole is a non-shockable rhythm and requires CPR and epinephrine. What medication is recommended for torsades de pointes? A. Epinephrine. B. Magnesium sulfate. C. Lidocaine. D. Atropine. Answer, B. Magnesium sulfate is the treatment of choice for torsades de pointes. What does the C in CAB, ACLS, stand for? A. Circulation. B. Compression. C. Cardioversion. D. Chest rise. Answer, A. CAB stands for circulation, airway, and breathing, emphasizing the importance of early compressions. What is the recommended energy dose for the first shock in a biphasic defibrillator for ventricular fibrillation? A. 50 joules. B. 120 to 200 joules. C. 300 joules. D. 360 joules. Answer, B. For biphasic defibrillators, the recommended initial energy dose for ventricular fibrillation is 120 to 200 joules. Specific dose may vary depending on the device manufacturer, but 200 joules is often the upper recommendation for biphasic defibrillation. Which medication is first-line treatment during pulseless ventricular tachycardia after CPR and shock? A. Atropine. B. Dopamine. C. Epinephrine. D. Verapamil. Answer, C. Epinephrine 1 mg 4/IO every 3 to 5 minutes is the first-line drug in pulseless VT after CPR and defibrillation attempts. It increases perfusion to vital organs and improves the chances of successful resuscitation. What is the correct rate for delivering rescue breaths to an adult patient with a pulse but no breathing? A. 10 to 12 breaths per minute. B. 6 to 8 breaths per minute. C. 12 to 20 breaths per minute. D. 8 to 10 breaths per minute. Answer, B. When an adult has a pulse but is not breathing, deliver one breath every 6 to 10 seconds, or about 6 to 8 breaths per minute, avoiding hyperventilation. What is the primary purpose of administering magnesium sulfate in cardiac arrest situations? A. Manage torsades de pointes. B. Reverse opiate overdose. C. Treat severe hypotension. D. Improve oxygenation. Answer: A. Magnesium sulfate is used to treat torsades de pointes, a form of polymorphic ventricular tachycardia often associated with prolonged QT interval. A patient suddenly becomes unresponsive with no pulse. What is the most appropriate next step? A. Check for breathing for 30 seconds. B. Give 5 rescue breaths. C. Insert a nasopharyngeal airway. D. Start high-quality CPR immediately. Answer: D. When a patient is unresponsive and pulseless, immediate high-quality CPR is the priority to circulate oxygenated blood and improve survival chances. What rhythm is most commonly associated with sudden cardiac arrest? A. First-degree AV block. B. Ventricular fibrillation. C. Sinus bradycardia. D. Supraventricular tachycardia. Answer: B. Ventricular fibrillation is the most frequent arrhythmia seen in sudden cardiac arrest and requires prompt defibrillation. Which of the following indicates effective CPR? A. Slow, shallow chest compressions. B. Minimal chest recoil. C. Visible chest rise and fall. D. Compression rate of 60 per minute. Answer: C. Effective CPR includes visible chest rise during ventilations, full recoil of the chest between compressions, and a compression rate of 100 to 120 per minute. After an advanced airway is placed, how often should breaths be given during CPR? A. Every 10 seconds. B. Every 6 seconds without pausing compressions. C. After every 15 compressions. D. After every 30 compressions. Answer: B. Once an advanced airway is placed, give one breath every 6 seconds, 10 breaths/min, without interrupting chest compressions. A patient is in asystole. Which action is appropriate? A. Immediate defibrillation. B. Start synchronized cardioversion. C. Begin CPR and administer epinephrine. D. Administer adenosine. Answer: C. Asystole is a non-shockable rhythm. Management includes high-quality CPR and administration of epinephrine every 3 to 5 minutes. Which of the following best describes return of spontaneous circulation, ROSC? A. Appearance of sinus bradycardia. B. Palpable pulse and measurable blood pressure. C. Cessation of chest compressions. D. Resolution of ventricular fibrillation on ECG. Answer: B. ROSC is defined as the return of a palpable pulse, measurable blood pressure, and sometimes spontaneous respirations, indicating that the heart has resumed effective pumping action.